Hello everybody, my name is Alan Fonseca. I'm a fourth year medical student at the University of Texas, Rio Grande Valley in Edinburgh, Texas. Our case report talks about bilateral Struvite stones leading to Xanthogranulomatous pyelonephritis. Other authors on this case report are DeAndrea Caesar, Dr. Steffi, and Dr. Cantazaro. Introduction to ZPN. ZPN is an uncommon form of chronic pyelonephritis. It is most common in middle-aged women and in the setting of obstructive kidney stones. Affected patients usually present with flank pain, fever, weight loss, and a history of recurrent urinary tract infections. The pathophysiology of this illness is due to granulomatous tissue containing lipid-laden macrophages which destroy healthy kidney tissue. So, case description. The patient is a 44-year-old woman who presented to the ED with left flank pain, which she described as sharp with radiation to the left hip and pain 10 out of 10 in severity. The physical exam showed a renal mass on the left flank and severe pain on palpation radiating to the groin. Over the last year, she's had similar presentation and was found to have bilateral renal Stackhorn calculi. The patient has had recurrent episodes of pyelonephritis due to MDR and ESBO protease mirabilis, with subsequent percutaneous nephrolithotomy and nephrostomy tube placement. As we can see on the left with image 1, it shows an X-ray demonstrating large Stackhorn calculi on the left kidney. The right image, image 2, is an abdominal CT which demonstrates similar large Stackhorn calculi which leads to left side of hydronephrosis. You can tell this is a more detailed picture. You can see the Stackhorn calculi in more detail. As we continue the case, the patient was admitted due to sepsis secondary to complicated UTI. The patient continued to be hypotensive despite fluid resuscitation efforts with MAPS in the 50s, and she was subsequently transferred to the MICU due to the need for vasopressors to maintain adequate perfusion. During the hospital stay, the patient decided to undergo left nephrectomy after deliberation with her surgery team. The patient subsequently developed post-op pancreatitis and a left pneumothorax. After medical management and chest tube placement, the patient's status drastically improved. The patient was seen in the clinic 1 week after discharge with significant improvement in her symptoms. As we can tell here, we have another CT image demonstrating large bilateral Stackhorn calculi and again left-sided hydronephrosis. You can see both Stackhorn calculi on this image. For discussion, although Stackhorn calculi are not uncommon finding in clinical practice, bilateral Stackhorn calculi leading to ZPN is rare. Stackhorn calculi are known to partially or completely occupy the renal pelvis, with possible extension into the renal calyces. The diagnosis of ZPN can be confirmed with radiological imaging and pathology. This patient's condition led to urosepsis and subsequent nephrectomy. This is due to the fact that Struvite stones rarely pass on their own and are needed for multiple bacterial infections. Before surgical removal, the Stackhorn calculi on the left measured 4 centimeters and on the right 2.2 centimeters. Although ZPN has not been diagnosed on the patient's right kidney, there's a high probability it eventually will. So for conclusion, this case illustrates that although Stackhorn calculi leading to ZPN is rare, it is nonetheless important for clinicians to consider this in the differential diagnosis due to serious complication if it is misdiagnosed. CT imaging in the patient's presentation will help medical professionals recognize and begin treatment. Thank you.